what about alternative business models within healthcare? So we've talked a lot about fee for service, but then there's alternatives that some people see as a panacea, some people don't, like value-based, outcome-based, direct pay, and so on. What do you view as the material differences between those business models?
So the value-based care is just another permutation, it's another manifestation of managed care.
Hmm.
Again, it was born out of the sense that, oh my gosh, the healthcare costs are so expensive because everyone's going to get unnecessary surgery, right? And going to specialists and so forth. So we're going to create this primary care model where everyone's going to go there first,
Hmm.
right? And get all your stuff done and maybe never get a disease, right? And therefore be healthy for the rest of your life and never need any kind of procedure. Um, so that was kind of came out of a world of public health people who think
Hmm.
that, not medical people, public health people who think you can like eradicate all disease, right?
Hmm.
Um, what in those models, value-based care is kind of part of that, where the primary care is the one who kind of manages your care, parcels out the money that they would spend on you, and if they didn't, if they saved money on you, if they theoretically if they kept you healthy or
Hmm.
prevented you from getting a referral from for to an orthopedic for that knee that bothers you, say, well, live with it or do this or do physical therapy, do something else, then they ostensibly would get some kind of refund or bonus back in their
Right.
system. So I personally think that that model can't exist today because that was existed when patients didn't have access to the information they have now.
Okay.
Patients are much more well informed. They actually have informed consent. They are more than capable of authorizing their own care. And my patients watch my surgery on YouTube or someone else doing. They come in way more informed than they did. So
Right.
so I don't think patients really need to. They have other resources now that they can kind of figure out. Gee, I've got something sticking in my eye. I can't see out of my
Hmm.
eye. Maybe I need an eye doctor. I think maybe. And primary cares are overwhelmed with their own patients that need them to manage their complex medical disease. They do not need to be a rubber stamp bus station. Like here, stop
Right.
here first to get to get your passport stamped before you get to go to the specialist, because that's just added waste for them as well, and why
Right.
they get overwhelmed. So those value-based care models, managed care, it all stems from an assumption that specialty care is more expensive and that they're somehow going to limit access to that. Direct pay is a completely different model where,
Hmm.
it started in the direct pay primary care world, where those primary cares could say, hey, forget it. I'm not a bus station. Okay, but I'm going to take care of you and I'm going to limit my practice and I'm going to spend time with you. I'm not going to limit you to 5 minutes. I'm going to be your doctor in the old fashioned way where I'm here for you. I can answer your call. But in order to do that, I have to limit my panel. And so people would say, okay, you're direct pay. So sometimes you can still use your Blue Cross or whatever, but you pay an extra concierge fee for that doctor to be available. And there's a direct pay component to it. So that is a very honest, accountable method of taking care of patients because the doctor answers only to you, right? Not to a third
Right.
party. And they can provide care that rather than what the insurance is incentivizing or disincentivizing,
Hmm.
they can feel free to offer the care for you that they do. The only problem is they need a network to provide the next step of care, right? That worked in the
Right.
DPC world, and that's where UberDoc comes in because now
Right.
there's specialists also that can take care of
Hmm.
you for that same transparency. Um,
Hmm.
so so that direct pay marketplace is emerging. We call it the DPO, is a
Okay.
very significant growth in employer-based models as well as individual.